Good afternoon again, ladies and gentlemen. Bill Gamble with Ameriplan. You know, we have talked to you extensively about our Dental Plus plan that provides you so many services: dental, vision, chiropractic care, and prescription drugs. And we've also talked to you about our Deluxe plan that includes all of the above, plus the telemedicine, which is the fastest growing medical service in the country. We've talked to you a few times about our advocate, the CARES group. If you have hospital bills that total in excess of $1,500, and believe me, we've seen hospital bills in the thousands of dollars, we have the advocate we call the CARES group, who will help you reduce those costs to the minimum according to what they should be and according to what you should pay. Making sure that you don't pay $200 for an aspirin. That's what the CARES group does. And we want to, plus you must be a member of Ameriplan before you have access to the CARES group, the advocate. I want to read to you a couple of testimonials of one who had a prearranged service, and a testimonial of one who had a medical service that was afterwards needed to be negotiated down. Let me read you one. These are true statements, and the names are the same. This is from Michael. Michael is a self-pay patient who reached out to the advocate team to pre-negotiate a planned surgical procedure. He needed surgery for prostate cancer and was having trouble with scheduling it. The hospital told him the only way he could have surgery done would to be able to pay for the service up front, which was $70,000. Michael reached out to the advocate, to the CARES group, and the case was assigned to our advocate. The advocate reached out to the hospital and spoke with the director and was told no on the spot. The advocate persisted, and in the end, he was able to get the procedure scheduled with the member only required to pay $10,000 up front, as opposed to $70,000. Michael was very pleased and thankful at being able to get the necessary surgery scheduled at a reduced upfront fee. He did not have to pay the $70,000 up front, was only allowed to pay only $10,000, and the advocate would help him with the rest of the bill. So that's an immediate savings of $60,000, plus help with the final bill, whatever it turned out to be. So what we're trying to get you to understand is we do have the CARES group, which you can refer to as the advocate, who will intercede for you for these expensive surgeries. And now that's one that was a pre-planned surgery. Let me read you one more that will convince you of what the advocate can do. Doris had $30,000 in chemotherapy bills for her cancer treatment. She and her husband, Alan, were feeling overwhelmed by the whole ordeal. Doris was too young to qualify for Medicare. To make matters worse, she and Alan owned some old rusty equipment that counted as an asset, and that prevented them from qualifying for Medicaid. The advocate helped them negotiate with the hospital to understand their financial situation, and the hospital agreed to reduce Doris's bill by 40%, a savings of $12,000. From $30,000 reduced by 40%, a savings of $12,000. Again, that's what the advocate, the CARES group, can do for you. One, you must be a member of Ameriplan to have access to the CARES group. But once you have access and your bills are more than $1,500, which is basically one visit to the doctor in many cases, the advocate can really reduce your bills. And so please call us again, and we'll be able to discuss that with you. You must be a member of Ameriplan to have access to the advocate who will work on your behalf to reduce those hospital charges to what they should be, something reasonable that's affordable and can be scheduled at reduced rates. So I have two examples that are just two of many examples that I hope if you listen, you can see the value of becoming a member of AmeriPlan to have access to the carriers group, the bill negotiator. So thank you very much. Call us and we can discuss this at length with you. Again, our number's at the bottom of this video. Call us and we'll just be happy to discuss that with you.